Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Root values and their reflexes. So we start off with the biceps. So when you look at the biceps, here the root value, the nerve involved is the musculocutaneous nerve. Musculocutaneous nerve is known as the MCN. So the root value here is C5 and the C6. Next we move on to the brachioradialis. The brachioradialis, it is by the radial nerve and the root value again is C5, C6. Now when you move on to the triceps, the chord increases, that is it is again by the radial nerve, and it was C5, C6, so it increases one step, that is C7 and C8. Then when you look at the fingers is going to be the median and the ulnar nerve, so it is the median as well as the ulnar nerve. So median and ulnar nerve, the root value here is going to be the C8 is the root value. Next we move on to the adductor. So here in terms of the adductor, the obturator nerve is the one which is involved, obturator. So obturator nerve is the one which is involved, and the root value here is going to be L2 as well as L3. This is the obturator nerve. Next comes the question on the knee. So what about the knee? The involvement of the nerve here is the femoral nerve. And what is the root value? Root value is going to be L3 as well as the L4 is the root value. Then we will ask a question on the ankle. So ankle is going to be the tibial branch. So ankle is nothing but the tibial branch, and this is of the tibial branch of the sciatic. The tibial branch of the sciatic nerve. And what is the root value here? The root value is going to be S1 as well as S2. So in ankle it is going to be S1 and S2. In knee it was L3, L4. In adductor L2, L3. Next we look at the plantar. So in terms of the plantar, the nerve involved is going to be the tibial nerve. Tibial nerve, and the root value is going to be L5 as well as the S2 is the root value. Next we move on to the abdominal. So what is there in presence of abdominal? So here in abdominal, the nerve which is involved is the upper quadrants. So you have the UQ upper quadrants, and that is the intercostal nerves. So in upper quadrant you have the intercostal nerves which is involved. And then when you move on to the lower quadrants, there is something known as LQ. LQ stands for the lower quadrants, and this involves the intercostal. So in lower quadrant there is intercostal, there is iliohypogastric, as well as presence of the ilioinguinal. Now what about the root value? In terms of the upper quadrant of the abdominal segment, it is going to be the T7 to T10. Next is in terms of LQ. LQ means the lower quadrants. In lower quadrants, it is going to be T10 to the upper lumbar segments, to the upper lumbar segments. So upper is going to be T7 to T10, and lower is going to be T10 to the upper lumbar segments. Now lastly we move on to the cremasteric and the anal reflex. So in terms of the cremasteric, so in cremasteric it involves the ilioinguinal as well as the genitofemoral. So it involves the ilioinguinal as well as the genitofemoral. So it involves the ilioinguinal as well as the genitofemoral. So in ilioinguinal and genitofemoral, the root value is going to be L1 and L2. Next we will have the anal. So in terms of the anal, the root value is going to be S2, S3 as well as S4. To learn and grow daily like this, please do subscribe.